Wendy is a nurse at Rwanda Health Center. She signs in for the day and has her first patient waiting. She's not feeling well, so she's going to do an acute illness. Her patient's name is E-Heza Silvana. She opens a new acute illness encounter and she conducts a symptom review. Silvana tells her she has had a fever for 3 days. She has had a cough for 3 days and some shortness of breath for a day. And she has not had any gastrointestinal symptoms. She then reviews her contact history. She has traveled to a district in Rwanda that has COVID. She's considered a COVID-19 suspect, so they perform a rapid test and it's positive, and she's not pregnant. Silvana has also come into contact with someone with COVID symptoms. She has not taken any medications for a fever. She's not taken anything for malaria. They conduct a physical exam. Her blood pressure is 100/60. Her heart rate is 110. Her respiratory rate is 28. And her temperature is 39 degrees Celsius. She has, as I mentioned, sinus tachycardia, and she has some mild crackles on her lung exam. And she has no other danger signs that she discusses with the nurse. She does have COVID-19 with pneumonia signs, but before we continue on, we're going to do a contact tracing. We're going to look for the people that she has come into contact with. We type in and find one person is already registered into the system, Soline. She documents the date that Soline had contact with Silvana and saves this. Then she adds another contact. She's looking for the contact, but she can't find this person on E-Heza, and so she can scroll down and add a new contact. In here she will add in Neza Sam. She'll enter the basic demographic information, and this information will later populate on a nursing case management tool, and the video for this will be shown later. Now you see we have Sam Neza registered as a contact. We can document the date that Silvana had contact with her and save it. And now we're finished with our contacts. And because this patient is relatively stable but does have some signs of pneumonia, she can be managed in the community. She goes home, but she is given amoxicillin at the appropriate dose for her age. And she is also registered to sign up for follow-up with the CHW, and this will show on the CHW case management system. And you can see the summary of this illness. And we close the encounter and go to our next patient.